Welcome back to sqadia.com. My name is Mohammad Osama, and today we are talking about environmental pathology. And in this series of lecture, the topic that we're going to talk about now is chemical abuse. So let's start off with what are the most common type of chemical abuse is the alcohol, tobacco, and drug abuse. So alcohol abuse, tobacco abuse, and drug abuse, the most common drugs that are abused include cocaine and heroin. So let's start off with the alcohol abuse. So alcohol is a drink which is used or which is taken in the form of celebration or even on a regular basis, and it's very common, especially in Western culture. So talking about alcohol abuse, it is the most important cause of death and disability from different causes ranging from automobile accidents when someone is driving in the state of being drunk or after consuming alcohol, or it can also be after homicides. So what are the pathological findings of chronic alcoholism? So the pathological findings include alcoholic hepatitis and cirrhosis, because the alcohol has to be degraded in the liver, and it is sort of like a toxin, it is sort of like a poison, and it damages liver. And chronic use of alcohol can lead to hepatitis and liver cirrhosis. It can also lead to acute and chronic pancreatitis, which is the inflammation of the pancreas, as well as inflammation of the stomach, because the alcohol goes into it and it can damage the stomach as well, leading to gastritis. Other than that, it can also lead to oral, pharyngeal, laryngeal, esophageal, and gastric carcinoma or malignant tumors, especially when it is used in combination with tobacco or smoking. It can also affect the heart in the form of alcoholic cardiomyopathy, in which there is a dilated heart, and it can also lead to aspiration pneumonia, as when something goes into the respiratory tract, and it can lead to aspiration pneumonia as well. And it can also lead to myopathy. And another thing in which it can also involve the central nervous system is in the form of cerebral dysfunction, in which hemorrhagic necrosis of mammillary bodies in the brain can occur in combination with thiamine deficiency. Other than that, it can also lead to Wernicke's syndrome, in which there is ataxia, that is impaired coordination, confusion, ophthalmoplegia because of the paralysis or the disruption in the function of the muscles of the eye, and nystagmus, which is the uncoordinated movements of the eye, repeated uncoordinated movements of the eye, and Korsakoff syndrome, in which there is memory loss, amnesia, and confabulation. A person perceives and looks things which is similar to hallucination. And there's another very important term, which is the fetal alcohol syndrome secondary to alcoholism or chronic alcoholism, which is because of the use of excessive alcohol by the mother when she is pregnant. So that can lead to microcephaly in the child, which is small head or skull, and which can lead to mental retardation as well, and facial and cardiac defects, which are very common in fetal alcohol syndrome. So long-term effects of alcohol or consequences of alcohol include slurred speech, breathing problems, concentrating problems because of amnesia and poor memory, as we discussed in Korsakoff syndrome. And a person can even go to a coma and death, motor impairment because of Wernicke syndrome, and ataxia, as we discussed about memory problems and amnesia and confusion, and reduced inhibition. A person does not have control on his action because he's drunk, and different type of health problems, and as we already discussed, increased risk for certain type of cancers, especially of the alimentary tract, as we discussed, oral, pharyngeal, laryngeal, esophageal, and gastric carcinoma. Now, the second one is tobacco use, and it is perhaps used a lot, especially in subcontinent as well, and other countries, and in some Western countries, there is a very strict observation of tobacco use or smoking in public places, but in other countries, it is used very commonly. And It is associated with squamous cell carcinoma of the larynx, squamous cell and small cell bronchogenic carcinoma, and transitional cell carcinoma of the bladder as well. So it is affecting the pulmonary system as well as the urinary bladder as well as the heart. It is affecting heart or the vascular system by atherosclerosis and other type of vascular diseases. Another very common manifestation of tobacco abuse in long term, it results in the chronic obstructive pulmonary disease and different type of other obstructive pulmonary disease such as chronic bronchitis and emphysema as well. And as I already told you, it can increase the risk for cancer like oral cavity cancer, larynx cancer, esophageal cancer, and myocardial infarction because of atherosclerosis, which can lead to emboli formation, and it can block the coronary arteries as well. Systemic atherosclerosis, as we already discussed, bladder cancer, and pancreatic cancer or peptic ulcer is also common with tobacco abuse. Now, drug abuse. So the two common type of drugs which are commonly abused include cocaine and heroin. So let's start off with cocaine. And cocaine is used by people because it gives a very good feeling to the individual because of euphoria and mood elevation. And but on the other hand, it also increases myocardial irritability, and it can, in severe cases, lead to fatal arrhythmias, which can lead in death. And it is also associated with hypertension, that is increase in blood pressure, and cerebral hemorrhage, resulting in cerebrovascular accidents and stroke, and thus upper motor neuron lesions. And it is also associated with nasal congestion, ulceration, and septal perforation in individuals who use cocaine via sniffing. And if someone is using it intravenously, then it is also associated with infections such as viral infection like human immunodeficiency virus or hepatitis B, or bacterial infections as well, such as infective endocarditis. And both of these conditions, either bacterial or viral, can be lethal for the individuals. The second one was heroin. It is usually used intravenously, so there's a high rate or chance of infections, including, once again, human immunodeficiency virus or AIDS, and hepatitis B, and infective endocarditis in cases of bacterial infection. And it has a very high physical dependence with severe withdrawal symptoms, so it is very easy to get hooked up on heroin, but it is very difficult to leave it. And it also results in adult respiratory distress syndrome, and death usually occurs from respiratory and cardiac arrest or pulmonary edema. So that was all about chemical abuse, in which we talked about alcohol abuse, tobacco abuse, drug abuse, in which we talk about cocaine and heroin. I hope you learned something new out of it, and keep on watching sqadia.com for more informative lectures. And thank you very much.